आज हमारे साथ है CEO of VivaVel Health Private Limited.
I have spent almost 23 years in healthcare business, mostly into sales and marketing.
I normally tend to ask to my every guest to say something about me.
I decided to start this firm, so I set up this company called VivaVel Health Private Limited. Viva is actually life and Well is coming from travel.
Assalamu alaikum. Hello everyone. Welcome to A for Akaash podcast. Today we are recording a special episode with our special guest Mr. Quazi Faizan Ahmad. He is the CEO of VivaVel Health Private Limited from India. Hello sir. Assalamu alaikum. How are you?
Walaikum Assalam, Akaash. Thank you very much for having me here. I'm good.
Okay. So before starting the interview, I used to do my interview in Bengali language, but today we are recording in English language. I want to make the introduction in Hindi language. If you just help me to do so.
Sure, क्यों नहीं? हम
So-
हिंदी में बात कर सकते हैं.
Yes,
I
yes.
think
Therefore,
many of your viewers must also be knowing Hindi thanks to our Bollywood movies.
right.
But we can talk, and even you can speak in Bangla. I understand Bangla.
Okay,
But I
but-
cannot speak, but I can understand Bangla.
Okay. So therefore, I just want to introduce to you with my audience in Hindi language. If you just help me to do so.
Absolutely.
What should I
So,
say?
You can just say somebody who was not doing anything is today here.
No. in Hindi language. That Assalamu alaikum. Hello everyone. Welcome to A for Akaash podcast. Today I have guest from India. So what should I say in this camera?
So you can say like, आज हमारे साथ
Okay.
फैजान है.
आज हमारे साथ है CEO of VivaVel Health Private Limited. You are from India. What should I say?
इंडिया से हैं.
Okay.
इंडिया से आए.
He India से आए हैं. Before starting the interview, I want to ask you about yourself. So
Sure.
just tell us something about your life, your career, your education, your country, anything you want to say.
Sure, I will. But before that, I think I should apologize because I noticed that you are finding it difficult to pronounce the name of the company VivaVel. Now, VivaVel is actually two words coming together.
Okay.
Viva is coming from Viva is Viva, which is long life, and Well is coming from travel. So the name that we took this VivaVel, we knew it would need a bit of explanation, but our team thought this is a good name.
Okay.
So we actually went ahead with this name. You asked me about my introduction. So my name is Faizan. I actually, I'm from India. I currently am living in India with my family. I have spent almost 23 years in healthcare business, mostly into sales and marketing. I have worked with many companies. I would say 6 companies before this venture that I started. I worked the last 23 years. I started my career with a diagnostics company. You may be knowing Runvax, right? Okay, so that was my first company where I took a job after completing my MBA. So I did my master's in analytical chemistry, and then I did my MBA in marketing. And in 2001, I took my first employment as a rookie. And there that was a good learning experience. I learned the basic of sales into diagnostics industry, specifically, and overall the healthcare industry. So I worked for almost 10 years in diagnostics industry. I've worked in companies like Saddle, Runvax, and Inquest Diagnostics, which is a US-based company. And when they started their India operations in 2007, I joined them. After that, I moved to health IT sector, where I worked with 2 companies, Walters Kluwer and Elsevier. So I launched the Walters Kluwer product, which is named as UpToDate. It's a clinical decision support tool in India. And there I was managing the entire business in India and also the channel business of UpToDate from Tunisia to South Korea. So it was a pretty large territory, and which involved a lot of traveling. And that gave me exposure to healthcare industry, I would say, in this region. I also spent some time working in a company in Bangladesh, where I was working as a general manager for one of the hospitals groups in Bangladesh. So I was living in Bangladesh, as you know.
I want to mention one thing that we both work together for the same company in Bangladesh.
Yes. So I was fortunate to having you in my team, and that was wonderful time we spent together.
Thank you so much.
Quite a good learning from you, I must say, and appreciate your hard work there. So having completed that assignment, which was a contract-based assignment, I went back to India. I was thinking of starting something of my own for a long time, and when I was in India, in Bangladesh, actually, I kind of, I would say I figured out, or rather short down myself on this health tourism business, because in India we used to see people coming from Bangladesh, people coming from other countries, from Middle East, from Africa, even other South Asian countries. So this is a very large industry. In India alone is 6 billion plus industry in dollars. When I was researching it, I thought where to start, because health tourism in India is a big market. Lot of people from multiple countries are coming to India. So I decided to start this firm. So I set up this company called VivaVel Health Private Limited. And as I explained, this Viva is actually life and Well is coming from travel. Our motto is live long, go healthy. Okay. And this is what we want to do. We want to assist the patient who are facing challenges in terms of accessibility of healthcare or affordability of the treatments. So we provide our services, our support to all the patients who are willing to come to India from many other countries, and even locally within the country, because India is a large country. A lot of people within India have to travel from one place to other places. I live in Delhi, and I'm originally from a city in Bihar. So I know people from states like Bihar, West Bengal, Odisha, etc. And likewise other states. They go to metro cities like Delhi, Mumbai, Hyderabad for better health quality services. So we are also offering our services to our local patients. So we provide end-to-end support to all the patients, right from their assistant in visa, finding the right doctor, right hospital, connecting them with the hospitals, facilitating this online consultation. Even we try to negotiate with the hospital a better or more suitable price for the patients. So we try to provide end-to-end services to all the patients, and we do not charge any money from the patients. So we get paid by the hospitals that actually is available. So that's what about me and what I'm doing currently right now.
Okay, thank you so much. Now I normally tend to ask to my every guest to say something about me, some good things which they found me in the professional tenure, and some bad things which I should be improved.
Well, thank you giving this opportunity and this candid question, obviously. Well, I have all good things to say about you. I really, when we were working together, I was actually impressed with your professionalism.
Thank you.
In fact, one of the reasons that we are sitting here right now today is because we maintained that even after going back to India, we were in touch. And when you said that you would like to do this podcast when you were come to Bangladesh, I said yes. So yes, there was that professionalism which actually builds the trust between the professionals. Because when we work together, we are working on the objective that the organization have given us. Right. And that same objective is actually divided between the team members. Right. So a part of that is done by me and part of that is done by you. So in this scenario, a professional trust is very, very important, that the work which is delegated to you or the support that you expect from me should be delivered on time the way you wanted, or if not better. So that was obviously a good part of you. So I appreciate your professionalism. And I would say the hand-on experience, because a lot of things that you knew about this local market which I did not. Okay, so that was very helpful. So your understanding of the healthcare market locally is very, very good. I appreciate that. And I don't have any bad thing per se to give to you, but I would say continue the good work.
Okay, thank you so much. In your perception, where you want me to see after 5 or 10 years?
Well, I would say follow your passion. I'm sure what you are doing is very, very good. I'm sure in the healthcare marketing you will succeed because you are a professional, you understand that business. And you told me that you started this podcast as your passion. So
Right.
follow this. This is always a good thing. And this would actually help people learn from others' experience. So take this a kind of your CSR thing and continue this thing.
Okay. So I also want you to say something about me to introduce myself with the healthcare community, especially with the healthcare community of India. You can use this camera as well
Okay.
in Hindi language.
ओके सो हिंदी लैंग्वेज में बोलना होगा सो मैं ये अभी बैठा हूँ आकाश के साथ में और आकाश मेरे टीम में हमारे साथ काम करते थे जब मैं बांग्लादेश में था रियली वेरी गुड प्रोफेशनल बहुत अच्छी जानकारी है इनको हेल्थ केयर के बिजनेस में और इनके प्रोफेशनलिज्म बहुत अच्छी है जिसकी मैं एक्चुअली अप्रिशिएट करता हूँ और या एनीथिंग यू वांट टू नो अबाउट आकाश आस्क मी
Okay, thank you so much. Why do you start your career in health sector and why in Bangladesh? Why you choose to be a businessman rather than a 9 to 5 secure job?
There was no reason not to select healthcare as a career. And these MNCs, large organizations, they have a very formal, very researched, very fine-tuned processes. Bangladesh economy is growing. It's growing very fast.